Hello, Portland. Hi, you guys. This is Brenda. Today, I'm going to just get right to it. Today, I want to talk about 5 ways that you can make your healthcare dollar go further for you. And with talking about that, I have my friend Leslie Parker with Health Benefits 411 to give some ideas. So again, my name is Brenda if you're just tuning in, and I'm with Care Solutions. I'm a licensed long-term care specialist right here in Portland, Oregon. So let's get started. Leslie?
Yes?
Let's talk about, first I want to talk about, tell me about your company, when you got started, and what do you do?
So my name is Leslie Parker with Health Benefits 411. I have been in the health insurance industry for a little over 10 years, and I am licensed both in Washington and Oregon. And I work in employee benefits. I work in individual and family insurance as well as Medicare. So I have a true passion for helping people make the best experience and value out of their health insurance at a time where it is very, very disruptive and a lot of turmoil going on in the industry.
Now, I didn't know you did for employee benefits. I never knew that.
Yeah.
Oh,
yeah.
wow.
Yeah. I have a number of employers I work with to find the plan that's going to work for them as an employer so that they know that they can afford the right product and also that they can get what they need for their employee base.
Oh, that's awesome. Because I was just, well, that's another video. So this is going to be not only helpful for seniors and their families, but also employers.
Yeah.
Or if your employer isn't doing that great, and you know who to call. Okay, so first thing first, let's talk about prescriptions. Tell us how we can save on prescriptions.
So prescriptions are a really tough thing right now, and a lot of things in the news about the cost of the prescriptions and different price points in different places where you can get prescriptions. So the thing I like to tell people is it requires research. I wish it didn't, but it does. And one of the tools that I think works really, really well is a tool called goodrx.com. And what that tool allows you to do is go online to their website, enter the prescription that you're interested in. It's going to ask you for the milligrams, if it's a tablet, any of those kinds of things. And then it's going to bring up in your area all of the retailers that sell that medication. And it's going to tell you what they're going to sell it for. And what is fascinating about it is you may see, you're going to see Walgreens, you're going to see Rite Aid, you're going to see Costco, you're going to see all of these different retailers, and you'll find that Safeway sells a prescription for $5 and Costco sells it for $25. And you're like, well, why does that happen? And it's based on different types of deals that these companies have made with manufacturers that allows them to get price points.
So frustrating.
It's very frustrating. And then the other thing is that for some people, they may have a copay. That copay may be $20 or $30. Well, if that medication at a cash price at a Safeway or a Fred Meyer or wherever is only $5.
Why use your insurance?
Why use your insurance for $20?
Yeah.
So the other thing that we talk about is that some medications, where it's appropriate, you can look to other countries. I work with a pharmacist and a pharmacy for over 10 years now in Canada. Now, Canada has restrictions on how they can help, so they cannot do anything that is a medication that is a classified drug, you know, a narcotic.
Like a narcotic.
Yeah.
And what about diabetic?
So the challenge with diabetics is that they can't do anything that is temperature controlled.
Okay, like insulin.
So some insulins, they're temperature controlled. So however, though, there was a diabetic that I worked with in this past week and was struggling with a cost of a medication. It's a tablet for diabetes. And with this tablet, she is able to manage her diabetes with the medication and diet. So, but she was struggling. It was $200 a month. And so we talked, and her insurance company had said that she should start taking insulin because it was cheaper. That was just very sad. Very, very sad.
Yeah.
So we did some research and we found out through Canada, and again, great group that I work with up there, that she could get that medication that she needed for $200 for 3 months.
Oh my word. What is that again? The Canada?
The Canadian pharmacy that I work with.
I know. Are you able to give that out, the name of it?
It's called GHM.
GHM.com?
I think it is. I work with them directly, so I just call the people that I've been working with. But it is just something that, again, when it comes to prescription drugs, you need to be a consumer. You need to use your consumer skills, because one of the things that
over your convenience skills.
Yeah.
Unfortunately, especially if you have, I mean, if it's an ongoing thing versus just an acute antibiotic that you need to get right away.
Right, and always we talk to people about using mail order to reduce costs. But I say don't use mail order if it's a medication you're just starting. You're not going to be sure that you're going to like it. If it's an antibiotic, use the 30-day in your local pharmacy. But if you were taking something that is something that you're really on, it's going to be something you're going to be on for a while, use the mail order, see if that reduces your cost. When you have medications, especially in Medicare, that are tier 3 or higher, those are going to run up your costs towards the donut hole, all of those kinds of things. That's where strategy really needs to come in to figure out how you can manage that cost.
So are you able to give me, you can share that information about the Canadian pharmacy, and we can put it in the link of this video.
Yeah.
Okay. Any more about prescriptions? Because that was very helpful. Wow.
I'll probably go on forever, but that's probably good.
I know. Okay. Okay. Number 2, I've never heard of telehealth. Well, I might have, but just not the name. Can you describe to Portland telehealth?
So one of the new technologies that are coming out in insurance, and you're going to be seeing them put into plans fairly regularly, I think now coming forward, is, again, it's all about cost control. How can we make our system more efficient? And one of the ways is through telehealth. And what that means is that you, the consumer, have a way to contact your doctor or their telehealth system. And that may be through a phone call. It may be through a link that you use on your computer. It may be something that you use on your smartphone. So what they want...
Smartphones.
Your smartphone.
Wow. So
the idea is, here's an example. So a gal I know had a child who had a rash. And her doctor was actually in Portland, and she was 3 hours away. So she was able to get that doctor on the line, take a picture of the rash, share it with the doctor, and get the appropriate analysis of what was going on. And then the prescription was called in, and everybody was happy. And no one left their home.
Versus going to the ER or urgent care.
Urgent care, and so the other thing is, we were talking about sinus infections, right? Okay, sinus infections. One of the pains, and they usually always want to arrive at Friday night.
It's so true.
Yeah, they want to arrive at Friday night. I don't know why.
I got a cold last Friday. Suffering a little. I hope you can't hear it.
So, and where is the last place we want to be, either on a Friday night or a Sunday morning?
Not urgent care.
Is not urgent care. So those are the kinds of things that telehealth is designed to do. We're not going to see it for things where, you've got a condition that is, not well suited for that kind of technology. And they'll tell you if you call and want to use the service, and if they don't think that this is where they can help, they are going to direct you elsewhere.
So let me pause you. So telehealth, does every insurance take that, or is it with your insurance company?
So each insurance company is adding that as a benefit at the time that they choose to. So some insurance companies are going to have that benefit. Some insurance are not, and will likely in the next year or so. Sometimes the benefit will actually be a lower cost. Some may not charge at all. So you just really have to look at your plan and see how that's being integrated.
But the telehealth is with your insurance company?
Is with your insurance company that is promoting it, and it is working with the doctor networks to be able to give you that access.
It's not www telehealth.
No, I mean there are a number of companies, and telehealth I think is a branded name. But when we as consumers are working through our insurance, we have to look at the one that the insurance has set up. It's really technology connecting you with physician-based health and letting you use that health process that way.
Now that was really good. Okay, you guys, if you're just tuning in, again, my name is Brenda with Care Solutions. I'm a licensed long-term care specialist, and this is my friend Leslie from Health Benefits 411, and today we're talking about 5 ways that you can make your healthcare dollar go further for you. So the third thing that we're talking about is retail clinics. Now, are we talking about the Paylesses and the Rite Aids and Zoom?
Right. Well, not so much Zoom, but so when we go into a Walgreens or different things, we're starting to see more clinics where they're offering additional services. You know, it's
not just your flu shot.
Right, not just your flu shot, where it was. And so this is more, again, insurance companies and doctors and hospital organizations trying to figure out other ways to provide care that bring down cost.
And what I love about those is that you get seen quicker.
Yeah. Well, and you're already there, typically, you know?
Oh, yeah, right.
So, again, it's just trying to create an access to care. The structure is there, and so they can bring somebody in. Now, it's going to be maybe a nurse practitioner or a physician's assistant or something like that. But for many, many things that we experience, that's fine.
Right. I mean, if you're seeing your physician for your diabetic, it's probably not, something you want to see them. But if you just sprain your ankle or, you have a sinus infection. Exactly. Yeah.
Those are, earaches.
Oh, yeah.
All that stuff. So those are things that are really a great tool. And, a lot of times they're trying to provide that access at a lower cost. So again, those are just more tools that we have to get access to care at a lower cost. That is our goal.
And the insurance company is covering those too?
So again, depends on your insurance. Okay. You have to look at it. Some of them will, some of them won't. So, but the goal is I think we're going to see more and more of that access as we go through.
I like it a lot. I've had to use that before, and it was way less than urgent care. Urgent care was $250, and one of those clinics was like $100.
Yeah.
For my son, he got hurt.
Yeah.
And it was minor though. If it's major, please use the hospital.
Yes.
So these are just tips. Don't misuse them. Okay, so number 4, testing and procedures. I love this one because a lot of people don't realize this.
So one of the ones I like to describe is the way the insurance companies are charged less to use certain facilities outside of hospitals. And it's important to remember that a hospital may end up charging you more because they have to be open 24/7.
Yeah.
At any time of the day or night, they have to be there ready to serve you. And so their costs are associated with that.
Yeah. Larger buildings.
Buildings, more people going on, everybody's got to get paid. So what now we're seeing more of is, and I use my daughter as this example, she tore her ACL. And it had to be repaired. And instead of going to the hospital for this surgery, we went to a clinic that is out near the airport. And the clinic was between Buffalo Wild Wings and IHOP.
I know that area, and I did not know there was a clinic there. I do know there's DSW.
Yes. So you can go to surgery and go shopping for shoes.
Yes, while you wait.
So, but what that allows is that clinic is only open Monday through Friday. It has business hours, right? So they can pass those savings on to consumers. And I don't think everybody realizes that. And those are things that, again, that insurance companies are going to start pointing out more, that you, the consumer, have some choices, and you need to evaluate them, if they're right for you. Not everything is right for you.
Right.
The other one that I like to talk about a lot is if you have something scheduled, like I call it the big stuff, which is the MRIs, the CT scans, all of those kinds of things. Again, hospitals have to have those open 24/7. There are facilities that are open Monday through Friday, and they can pass the savings on. Their cost may be less for you. So those are things that I want people to understand, that they can get a lower cost. And when you have to pay out of pocket for some of these things, that's important.
I remember doing lab work at a smaller facility versus the hospital. So, there's those options too. And those CT scans or MRIs, there's clinics for those.
There are.
And they're all over. And so would you contact your insurance first to find out which ones?
Yeah, which ones are in network. And, again, part of the things that technology can give us these benefits is because we have all these medical records, right? So it's not like you have to go and get this test and then take your record and walk it over to your,
Goodness.
Yeah. So you as a consumer aren't going to have this, process that's going to be onerous because you didn't go, to another facility. So again, check with your insurance company, see which ones that are in network so that you can get the best value.
Okay, that was really good. Okay, doctors network. Let's talk about that.
Yeah. So, couple of things. The insurance companies are working very hard to control costs, because that is, we all don't want to pay a huge amount of money. We don't want to go broke on our healthcare, and so everybody's trying to figure out ways to control costs. One way that has been successful in some perspectives is that when they kind of control the amount of doctors, hospitals, and clinics that we can go to. So what's important is that when you are shopping for insurance or looking to change an existing plan, that you know which networks are in your plan, and that you have done the research to see if the doctors you're currently seeing are in this network that you're looking to go to.
Not just your PCP.
No, not just your PCP, your specialist, and all of that.
Yes.
And the other thing that I always like to remind people, and again, they have to take this personally of their own, what makes sense to them, is that because I get into the situation, you are making a commitment to that doctor for the time that you're in that insurance plan.
Right. Mm-hmm.
But your doctor could leave that plan, right? They may retire, they may move out of state. There's a lot of things that may happen. So one thing I also suggest is that, if you don't have a PCP, or if you're just kind of looking around, is, maybe find one that is got a broad enough group of practitioners that if yours were to leave, that you liked the whole practice that you're seeing. And know that if you're not comfortable with your PCP, mm-hmm. you can always change them. Never stay with a PCP that you're not satisfied with. Please, you can change.
Because, it's so true. Two things that I've experienced. People do go out of business. Mm-hmm. It happens a lot. When I was looking for a naturopath, I was going through the list, and so many of them, even though they were, here's the other thing. Make sure that when you get the list, when I was looking for a naturopath, they gave me a list, and some of those people weren't even there, or they weren't taking, so you need to make sure and match up.
Yeah.
Make sure that it's still correct.
So the lists, through technology, they work very hard to make them as current as possible, but it's kind of like herding cats. These lists are thousands of practitioners, and people are, there's life. They're moving in and out for whatever reason that they need to. So, verification.
Verification that they still take the insurance and they're still existing, both ways. It took me hours and hours to find which one was actually there, and to know which one to choose from. And then also, my recommendation would be that, I've lost my train of thought. This cold. But that when you were talking about making sure that you like your physician, because if anything happens, I had a physician one time that it was great when I had a cold, but when there was something major happen, mm-hmm. we disagreed.
Oh, okay.
And when they disagree, it was not good. It was not good at all.
And the other thing I want to remind people is that when it comes to your PCP, some plans are HMOs, mm-hmm. which require your PCP to provide you referrals to specialists. If it's so HMOs require, and if it's a PPO, you wouldn't necessarily have to have a referral, but some specialists require a referral. So again, just things that you need to know as far as how your plan works.
So I have a question, Leslie. I know we're basically wrapped up our 5 ways you can make your healthcare dollar stretch for you, but I just have to ask her a couple of questions. Do you take on new clients?
Oh yeah, definitely.
Okay, so I think that's important. As you can see, she knows so much about health insurance, all these acronyms. They could go on and on. Even in my industry, there's so many acronyms.
Yeah.
And so, as you can see, Health Benefits 411 is a place that you need to make sure and get to. I have an agent that, not everybody's created equal. Mine sadly is not. She's not as helpful as you. And so it's time to change. So remember, if you're not getting that service that you really need, or they don't sound as smart as Leslie, time to make a change. Leslie, thank you so much. And so tell us how that someone can get a hold of you.
So the best way to get a hold of me is probably my phone. That's 503.
Don't hunt her down. No stalking.
891-5793.
Okay, one more time.
503-891-5793.
Okay, perfect. Now, any chambers that you belong to?
Yes. I belong to the Gresham Area Chamber of Commerce and have been for about 3 or 4 years now. And I have a lot of fun. They're great
A
people.
lot of fun. And you also like a part of the resource team and stuff.
Actually, I'm an ambassador.
Oh, ambassador.
So I get to wear a blue vest when I go to meetings.
So not only is she super helpful, but she's also at the chamber. So if you want to stop by, especially if you're an employer, if you want to stop by and talk to Leslie, again, Health Benefits 411. And again, my name is Brenda, and I'm a licensed long-term care specialist here in Portland, Oregon. I look forward to answering any questions, and I'll make sure and put Leslie's information down below so you can find out how you can get signed up with Leslie and go over your benefits. Thank you, Leslie. This was fun. This was fun. We'll do this again because my next topic is I want to talk about more about health benefits and coming up ways, things that we haven't thought about, when renewal is for seniors and things like that.
Yeah.
Lots of questions, and that I don't even know all the, how to ask questions. And I know that when people come to me, they feel the same way. They don't know all the questions to ask, and so we'll work on that, and we'll get another video in. Okay, you guys, have a great Friday, and again, a good morning. Bless you. Have a great day. Bye-bye.
Have a great Memorial Day.
Okay. Yeah. Oh, yeah. Happy Memorial Day.